Bismillahirrahmanirrahim. Today we are going to study about a serious life-threatening condition called malignant hyperthermia. Hyper means increased, thermia means temperature. In this condition, there is increased heat production in the body. That's why it is called hyperthermia. It is defined as a serious life-threatening condition characterized by a state of hypermetabolism and massive rhabdomyolysis. Rhabdomyolysis is the muscle breakdown. It is a serious condition, a serious syndrome due to direct or indirect muscle injury. It results from the death of the muscle fibers and release of their contents into the bloodstream. This can lead to serious complications such as kidney failure, there is Coca-Cola colored urine in the there is Coca-Cola colored urine. Also there is the increased metabolism or hypermetabolism. So what is hypermetabolism? Hypermetabolism is a state in which there is speedy breakdown of carbohydrates, proteins, and triglycerides in order to meet the increased metabolic demands. What are the causes? The causes are defect in the receptors within sarcoplasmic reticulum. These receptors are the nodine receptors, which are located in the sarcoplasmic reticulum and are responsible for the release of calcium ions from the intracellular stores during excitation, contraction, coupling in both cardiac and skeletal muscles. Also, there is CACNA, one S gene involvement. This gene provides instructions for making calcium channels. These channels, which transport positively charged calcium ions across cell membranes, play a key role in the cell's ability to generate and transmit electrical signals. So, the calcium ions are involved in many different cellular functions like cell to cell communication, muscle contraction, and regulation of certain genes. The other cause for it is the volatile anesthetic agents. Examples of these are the halothane, sevoflurane, and skeletal muscle relaxant. Succinylcholine. This is the other reason for the malignant hyperthermia. Now coming to the pathophysiology of malignant hyperthermia. The triggering agents such as succinylcholine and volatile anesthetic agents in a genetically predisposed patient release calcium from the sarcoplasmic reticulum. So, leading to elevated concentration of the calcium in the muscle cells. This elevated concentration of calcium causes hypermetabolism and is responsible for the symptoms of malignant hyperthermia. How will you do definitive diagnosis of malignant hyperthermia? Definitive diagnosis. A person with a history suspicious of malignant hyperthermia should undergo the following tests. Number one, skeletal muscle biopsy. Then there is caffeine, halogen contracture test. This is a criterion standard for establishing the diagnosis of malignant hyperthermia and is performed on freshly biopsied muscle tissue. It is only performed in 30 centers worldwide in UK, Canada, and USA. Also, a third test which you should do is genetic susceptibility testing for ryanodine, ryanodine and the CACNA1S receptor mutations. So these three tests should be done: skeletal muscle biopsy, caffeine halogen contracture test, and genetic susceptibility testing for ryanodine and CACNA1S receptor mutations. Now coming to the early signs of malignant hyperthermia, there is hypercapnia. Hypercapnia is the increase in partial pressure of carbon dioxide above 45 mm Hg. Also there is tachycardia. The heart rate is increased. Also there is muscle rigidity. The muscles become rigid. tachypnea, rapid and shallow breathing, hypoxia, decreased oxygen in blood, arrhythmias, abnormal heart rhythms. These are due to increase in calcium in the muscles, cardiac muscles. There is unstable blood pressure and flushed cyanotic or ruddy skin. So these are the early signs of malignant hyperthermia. Now coming to the late signs. The late signs are fever or diaphoresis. Fever or diaphoresis is the sweating. It increased heat in the body. Respiratory and metabolic acidosis. There is high potassium, calcium ions, magnesium ions, glucose, creatine kinase, and shortcut we call it CK, lactic dehydrogenase, in shortcut we call it LDH, and SGOT. There are the things which become low are the clotting factors. They become low, and there is myoglobinemia. Decreased myoglobin in blood. These are the late signs of the malignant hyperthermia. Now we come to the steps for treating malignant hyperthermia. Steps for treating malignant hyperthermia. I denote it by MH. First of all, page the staff anesthesiologist. Usually, the anesthesiologist is the person who is better capable of treating the malignant hyperthermia. He has got the relevant training in treating the malignant hyperthermia. You have to discontinue the triggering agents such as volatile anesthetics which are you using and succinylcholine, the skeletal muscle relaxant which might have triggered the malignant hyperthermia. The surgical procedure should be discontinued as soon as possible. Start total intravenous anesthetic agents. T for total, I for intravenous anesthetic agents. You should hyperventilate with 100% oxygen. As there is hypercarbia and decreased oxygen in the blood, so you have to hyperventilate with 100% oxygen at high flow rate. Then give dantrolene sodium 2.5 milligram per kg intravenously, IV for intravenously. Obtain labs like arterial blood gases, serum electrolytes, creatine kinase denoted by CK, urine myoglobin, and do coagulation parameters or profile. So give dantrolene sodium, obtain the labs, arterial blood gases, electrolytes, creatine kinase, urine myoglobin, and coagulation parameters. Also, then treat the hyperkalemia, the increased potassium in blood. How will you treat them? Give calcium chloride. So you have to treat the hyperkalemia with calcium chloride and glucose and insulin. These decrease the potassium in the blood. You have to treat the metabolic acidosis with bicarbonate 1 to 2 milli equivalent per kg. So you have to treat the metabolic acidosis with bicarbonate 1 to 2 milli equivalent per kg. So again, I will revise the steps. Page the staff anesthesiologist. Discontinue the triggering agents such as volatile anesthetics like halothane and skeletal muscle relaxants such as the succinylcholine. Discontinue the surgical procedure as quickly as possible. Start total intravenous anesthetics. Hyperventilate with 100% oxygen at high flow rate. Then give dantrolene sodium 2 milligram, 2.5 milligram per kg IV. Obtain the labs such as arterial blood gases, electrolytes, creatine kinase, urine myoglobin, coagulation parameters. Treat the hyperkalemia with calcium chloride, glucose, insulin, and treat the metabolic acidosis with bicarbonate, sodium bicarbonate 1 to 2 milliequivalent per kg. In case of hyperthermia, you have to cool the patient. This is also come in the step for treating the malignant hyperthermia. Cool the patient with cold IV saline. Apply ice packs to groin region, axilla, do nasogastric lavage with cold solution. Put Foley's catheter for urine output. The patient should be admitted in ICU. Cool the patient with cold IV saline. Apply ice packs. Foley's catheter for urine output, ICU admission. There is a mnemonic which you can remember for treating the malignant hyperthermia. The mnemonic is some hot dude better give iced fluids fast. So the alphabets in red, you have to remember. S for stop the triggering agent. H for hyperventilate with oxygen. D for dantrolene sodium. B for give bicarbonates for treating the metabolic acidosis. G for glucose and insulin. I for IV fluids and cooling blanket. F for fluid monitoring or furosemide and F for fast heart arrhythmias. So this is a mnemonic for treating the malignant hyperthermia. Some heart dude better give iced fluids fast. Stop the triggering agent. Hyperventilate with 100% oxygen. Dantrolene sodium 2.5 milligram uh, per kg IV. Bicarbonates, glucose and insulin, IV fluids and cooling blanket, and fluid monitoring or furosemide and fast heart. So this was all about malignant hyperthermia, its causes, pathophysiology, the symptoms, and its steps for the treatment.